Have you always wondered what type of diet plan you should follow? Do you know what intermittent fasting is? Are you a type 2 diabetes patient and looking for natural ways to reverse it? This video will help you answer all of these questions and demonstrate why intermittent fasting is the best treatment option for type 2 diabetes patients. Don't forget to like, comment, and subscribe to this channel and share this video with your friends and family. Let's get into the video. What is intermittent fasting or IF? Intermittent fasting is a sort of eating pattern in which eating and fasting times are alternated. While many diets concentrate on what to eat, intermittent fasting focuses on when to eat. When you practice intermittent fasting, you only eat at specific times of the day. Fasting for a set number of hours per day or eating only one meal a few days per week can help your body burn fat. Reasons to do intermittent fasting. Fasting causes significant drops in blood sugar and insulin levels, as well as a considerable increase in human growth hormone. Many individuals use intermittent fasting to reduce weight because it is a simple and efficient approach to limit calories and burn fat. Others take it for the metabolic health advantages, since it has been shown to improve a variety of risk factors and health indicators. In addition, there is some evidence that intermittent fasting can help you live longer. Rodent studies suggest that it can increase longevity just as well as calorie restriction. Some studies show that it may also help protect against illnesses such as heart disease, type 2 diabetes, cancer, and Alzheimer's disease. Today, doctors suggest certain types of intermittent fasting diets to people with type 2 diabetes. Furthermore, recent studies show that the timing of a person's fasting might be equally crucial to the diet itself. According to the Center for Disease Control and Prevention, diabetes affects more than 30 million individuals in the United States, with 90 to 95% of them having type 2 diabetes. Cells in people with type 2 diabetes do not respond appropriately to insulin, which helps manage blood sugar levels. What are some of the benefits of intermittent fasting for people with type 2 diabetes? IF can have a variety of health benefits for people with diabetes. Number 1, promoting weight loss. Number 2, increasing insulin sensitivity, resulting in reduced insulin needs. Number 3, restoring normal fasting blood glucose levels. And number 4, lowering A1C hemoglobin levels. IF may help type 2 diabetes patients to improve certain metabolic parameters like hyperlipidemia, metabolic syndrome, or hypertension. How does intermittent fasting help with type 2 diabetes? Glucose metabolism. In order to properly comprehend the benefits of intermittent fasting for people with type 2 diabetes, one must first comprehend the working of the body in regards to the action of insulin and glucose. Insulin is a hormone that allows glucose or sugar obtained from food to enter muscle cells, stored fat cells, and the liver, where it is utilized for energy. When blood glucose levels rise, the pancreas releases insulin. Insulin reduces blood sugar levels by transporting glucose into cells, keeping blood sugar levels normal. Insulin resistance. There is an accumulation of glucose in the blood when the cells of fat, muscles, and liver are not able to respond correctly to insulin, and this blood is then unable to reach the cells properly. This is referred to as insulin resistance. In order to overcome the problem of insulin resistance, the pancreas will try to produce more insulin so as to make sure that the blood sugar enters the cells. The blood sugar level will remain normal until the pancreas is no longer able to produce enough insulin to compensate for the cell's weakness. Prediabetes. Prediabetes is borderline diabetes where the levels of blood glucose are higher than they should be but are not high enough to be diagnosed with diabetes. Prediabetes is typically diagnosed in those who have some amount of insulin resistance. Prediabetes can also occur when there is not enough insulin produced by the pancreas so as to make sure that the blood sugar levels are kept within the normal range. Prediabetes frequently progresses to type 2 diabetes over time. Types of intermittent fasting for diabetes. There are numerous intermittent fasting diets that have had preliminary study done on their usefulness and safety for diabetics. Let's look into each one carefully. The 5-2 intermittent fasting diet. The 5-2 intermittent fasting diet, which is also known as the 5-2 diet, is a popular fasting diet that consists of intake of calories recommended for 5 days and eating a reduced calorie diet for the rest of the days of the week non-consecutively. Food is not completely eliminated on fasting days. Rather, the number of calories consumed is reduced. Studies on the 5-2 diet. The 5-2 diet has shown in studies to help people with type 2 diabetes with reduction of insulin resistance and promotions of weight loss. The first long-term research of the 5-2 diet, published in the Journal of the American Medical Association in 2018, showed that intermittent fasting may be beneficial for diabetics who struggle to keep a long-term daily eating regimen. The research included 157 patients with type 2 diabetes, with half following the 5-2 diet and the other half adhering to a daily calorie-restricted diet, comprising 12 to 15 calories per day. The group that fasted 2 non-consecutive days per week ingested 500 to 600 calories on fasting days and followed a regular calorie intake for the rest of the week. The study showed that individuals who followed the 5-2 diet were equally as likely as those who maintained the continuing restricted calorie diet to regulate their blood sugar levels. Research revealed that for weight loss, the 5-2 diet may be preferred to continuous calorie restriction. Before trying the 5-2 diet, people with diabetes must consult their doctor about a daily calorie intake regime for the entire week. Early Time Restricted Feeding Diet, or eTRF. The Early Time Restricted Feeding Diet is a highly popular diet form of intermittent fasting that has been examined in diabetics. Following this fasting meal plan entails fitting all of one's meals within a specified time slot each day. The eTRF diet plan might be 8 hours, 10 hours, or even 6 hours in length. If a person starts eating at 8 a.m., their last meal or snack for the day must be at 4 p.m. on the 8-hour pattern. In a 12-hour eating schedule, if a person had their first meal of the day at 9 a.m., then their final meal or snack would be at 9 p.m. How does the eTRF diet work? The eTRF diet is thought to assist weight loss by synchronizing metabolism with a person's circadian cycle, the biological clock of the body, which controls different activities like cellular metabolism, is referred to as the circadian rhythm. When the meal schedule was changed to earlier in the day, which would therefore extend the overnight fast, it was discovered to substantially enhance metabolism. Fasting causes a few key biological activities, such as blood sugar reduction and metabolic enhancement. Diabetes research on the eTRF diet. In a 2018 study, the 8-hour early time restricted eating regimen was compared to the 12-hour diet. Both groups maintained their weight and had considerably lower insulin levels, as well as reduced blood pressure. Alternate day fasting. People who follow this routine alternate between a fast day, when they consume no or few calories up to 500, and a feast day, when they can eat anything they want. Eat, stop, eat. People who follow the eat, stop, eat diet must not intake any food and calorie-containing beverages for 24 hours straight for 1 or 2 times a week. Instead of treating the other days of the week as feast days, they should eat responsibly on them. Some side effects of intermittent fasting for people with type 2 diabetes. A chronic condition such as diabetes may enhance a person's chances of suffering several of these negative occurrences. According to researchers, in persons with type 2 diabetes who use insulin or other medicines, such as sulfonylureas, there is a risk of hypoglycemia. Dehydration is also a risk. On fasting days, there can be dehydration in persons following an intermittent fasting diet plan, even if there is intake of calorie-free liquids if they do not drink additional drinks. Hypotension can result from dehydration. Some drugs may need to be reduced or discontinued on fasting days. Diuretics, antihypertensives, and diabetic medicines that might cause dehydration, such as SGLT-2 inhibitors, are examples of these. Some other possible side effects of IF are dizziness, nausea, insomnia, syncope, fainting, migraine headaches, weakness that limits daily activities, excessive hunger pangs. What should a type 2 diabetes patient do before trying intermittent fasting? Before beginning IF, a person with diabetes must talk to their doctor to confirm that it is safe for them. To decrease the risk of hypoglycemia, a person will also require their doctor's advice on modifying the doses and timing of their prescriptions. Individuals experimenting with IF should monitor their levels of blood glucose more often, preferably every 2 to 4 hours, particularly when they initially begin. Diabetes patients suffering from hypoglycemia must promptly break their fast and take glucose pills or gels with 15 grams of carbohydrates in order to bring their low blood sugar to normalcy. Before resuming the fast, they should speak with a doctor. It is also critical to take extra fluids throughout the fasting time to avoid dehydration.